Hi, I'm Dr. Divya, consulting physician, Calicut Ayurvedic Clinic, Barka, Oman. Today, I'm going to talk about the topic frozen shoulder. Frozen shoulder is also known as adhesive capsulitis. It is characterized by stiffness and pain in the shoulder joint, thereby limiting its range of movement. Now let us see what are the common causes of frozen shoulder. One of the most common cause of frozen shoulder is the immobility that may result during recovery from a shoulder injury, arm fracture or a stroke. If you have a weak immune system or you have a hormonal imbalance or diabetes, you are more likely to get an inflammation in the shoulder joint. Frozen shoulder happens when scar tissue forms in the shoulder, causing the capsule of the shoulder joint becoming more thicker and harder. This will leave less space for the movement of the shoulder, thereby restricting its movement. Now, what are the common symptoms of the frozen shoulder? Swelling, pain and stiffness of the shoulder joint are the common symptoms exhibited by the patient with frozen shoulder. Usually, the patients will become aware of the frozen shoulder only when the shoulder joint begins to hurt them badly. Reaching for an object from a higher shelf becomes difficult for a patient with severe frozen shoulder. Usually the patient's condition when becomes severe, they will feel difficulty in their daily routine activities like dressing up, which includes the movement of the shoulder joint. Common risk factors include age. The people in the age group between 40 and 60 years are more likely to get frozen shoulder. About 70% of the people with frozen shoulder are women. Recent injury, arm fracture or stroke leads to immobility, thereby causing frozen shoulder. Other risk factors include Parkinson's disease, cardiovascular disease, hyperthyroidism or overactive thyroid gland, hypothyroidism or underactive thyroid gland and stroke. Now let us see how can we manage the frozen shoulder through Ayurveda. In Ayurveda, frozen shoulder is referred to as Ababahuga, in which the Vata dosha is vitiated and gets accumulated in the shoulder joint, absorbing the fluid and thereby causing the stiffness of the shoulder joint. Frozen shoulder can be kept at a distance by practicing yoga and meditation, mild exercises and through proper diet. Proper diet includes the intake of fresh fruits and vegetables, nuts, probiotics like yogurt, avocados, olives, etc. In Calicut Ayurveda, we are treating the cases of frozen shoulder by combining the authentic Ayurveda along with Kalari Marma Chikitsa, which includes various postures of the shoulder joint. Here we are using the treatments like Abhyanga, that is the proper oilation of the shoulder joint using warm oil, fomentation, nasya, that is instilling of medicated drops into the nostrils, and at last we will be doing an Ayurvedic herbal bandaging. The course duration of the frozen shoulder treatment may last from 7 days to 21 days depending upon the severity of the symptoms exhibited by the patient. Over the last 3 decades, Calicut Ayurveda have dealt with many cases of frozen shoulder, and we can proudly say that we could give 100% satisfaction to our patients, thereby providing better relief and making them symptom free. Stay healthy and happy through Ayurveda. Thank you.